Welcome to today's press briefing. We have with us from the CHP Communicable Disease Branch Principal Medical and Health Officer Dr. Albert Au, and from the Hospital Authority Chief Manager Dr. Larry Lee. We'll first hear from Dr. Au. Good afternoon, everyone. I'll now report the situation as at yesterday. Data from the CHP in relation to PCR positive cases. There were 5,732 cases, a number from 705,159 to 710,890. These 5,732 cases, 805 of them were picked up by the Hospital Authority. 353 were picked up by Public Service Laboratory. The remaining 4,574 cases were picked up by private laboratories. Yesterday, we have received 7,342 valid RAT positive cases reported. Altogether, yesterday, we have confirmed 13,740 cases. In Hong Kong, in the fifth wave, there are 1.08593 million cases, well, of which 698,253 PCR cases and 390,340 RAT cases. In the confirmed cases yesterday, there was one imported case. The remaining were local cases. In relation to genome sequencing, we have conducted some analysis on 1,216 samples. One was identified to carry L452R positive. 1,190 cases were confirmed to be negative to L452R, that is Omicron cases. 24 of them have got an insufficient viral load. Yesterday, there were 3 additional residential care homes that have reported outbreaks. That includes 3 elderly care homes and 2 care homes for the disabled. There are 61 cases, which include 38 residents as well as quite a number of staff members. Altogether, there are 782 care homes that have seen positive cases, of which 60 of them were in the last 2 weeks. That accounts for 7.5% of the total number of care homes for the elderly. It involves 1,260 residents and 257 staff members. Of care homes for the disabled, so far 284 care homes for the disabled have seen confirmed cases. In the past 2 weeks, 35 care homes for the disabled have seen new cases or outbreaks. That accounts for 10.4% of the total number of care homes. There are 692 residents and 255 staff members who were involved. In relation to death cases in care homes, so far we have a total of 3,501 deaths. In relation to the death cases in the fifth wave, as at yesterday, there are 6,557 deaths. Compared to the day before, we have seen an additional 201 cases. So far, the death rate is 0.6%. In the 6,557 cases, there are 262 female and 3,925 male. The age range is there are 7 children cases and also 260 adults. For the remaining 6,281 cases, they all involve those aged above 60, which accounts for 59.8%. 4,642 death cases involve those aged above 80, which accounts for 70.8% of the total number of cases. Of the additional 201 cases, 7 of them were reported by a forensic pathologist. That involves 5 males and 2 females. The age range is 87 to 98. In relation to vaccination, according to the latest analysis conducted by the CHP, of all the death cases, those who have not received any vaccinations or only got 1 dose, the death rate is 1.76%, compared to those with at least 2 doses, which is 0.11%. There is a difference of 16 times. Those above the age of 60, if they have received 1 or less dose of vaccination, the death rate is 11.45%, compared to those with at least 2 doses of vaccine. 3.38%, there is a difference of 3.4 times. We'll now hear from the hospital authority. Well, so far we have 11,193 patients staying at public hospitals, community treatment facilities as AWE, North Lantau Hospital, as well as Infectious Disease Center. 40 patients were in a critical condition. 18 of them have not received any vaccination. 64 of them in a serious condition. 108 patients in a critical condition are in the ICU. As at midnight last night, we have 152 patients that have passed. 78 male and 74 females aged between 24 and 100. In the 152 patients, 64 came from care homes. 103 of them were not vaccinated at all. 37 have received 1 dose. 12 of them have received 2 doses. 140 of them are aged above 65. There are 6 cases that involve a younger age, and I will elaborate. First is a 24-year-old male with 2 doses of a vaccine. He has chronic illnesses, is also in the late stage of cancer, undergoing chemotherapy. On 18th of March, about 2 a.m., because of cramps, he was sent to A&E at Tuen Mun. He was tested positive. Paxlovid was prescribed. As his condition was quite poor, we have prescribed remdesivir as well as steroid. However, his situation continued to decline. At about 4 a.m. on the 23rd, he passed away. The second case is a 45-year-old female. 2 doses of a vaccine. No medical history. Is an Indonesian helper with symptoms of poor appetite, fever, and the shivers. On the 23rd, the situation got worse and she lost consciousness. She was sent to A&E at Quang Wa. On the way, she remained unconscious. After resuscitation, her heart started beating again. She was screened positive upon admission, but her condition continued to decline. On the 23rd of March at 1:48 a.m., she passed away.
The third patient was a 48-year-old male. He did not have any vaccination record. He was a chronically ill patient. He also had a tumor in his brain and also hemorrhage. Last year, on the 27th of December, he was admitted to United Christian Hospital through the A&E unit. He remained unconscious and he was in the medicine ward for some time. And in February, he was transferred to the Havens of Hope Hospital for further treatment. On the 1st of March, he was infected with COVID-19. And after some time, his condition deteriorated. And on the 22nd, His blood oxygen level was found to be low, and he was prescribed with steroid and antibodies, and he passed away on the 23rd of March. The fourth patient was a 53-year-old female without any vaccination record. She also suffered from terminal cancer, and on the 31st of January, she was admitted to Princess Margaret Hospital through A&E unit because of weakness in her lower limbs and also spinal pain. That was probably due to the spine being pressed. She was admitted for the purpose, and she was found to be infected with COVID-19 on the 1st of March, and she also suffered from pneumonia, and her condition deteriorated starting from the 15th. She relied on oxygen support and passed away on the 23rd at about 5 a.m. The fifth patient, a 55-year-old male, again no vaccination record and chronically ill. He was admitted to hospital through A&E of Princess Margaret Hospital in the morning. At that time, he was screened positive via RAT, and he had a fall, and therefore it was admitted to hospital, and he was found to have pneumonia. And on admission to hospital, he was given a cardiac booster jab and also other forms of treatment. But unfortunately, on the 23rd of March, he was found to be unconscious, and upon resuscitation, he passed away at about 1 p.m. on the 23rd of March. The sixth patient, 55-year-old female, chronically ill, living in a home. On the 27th, she visited the A&E unit of Queen Elizabeth Hospital because of continuous convulsions. She was injection was administered, and she was intubated, and on being admitted, she was found to be COVID positive. Her condition continued to deteriorate. Towards the end of March, in fact, she passed away on the afternoon of the 23rd of March. Last patient is 56-year-old male, no vaccination record. He also suffered from a terminal cancer. On the 3rd of March in the afternoon, because of shortness of breath, he visited the A&E unit of Queen Elizabeth Hospital. He also knew he was COVID positive, and he was found to have a lung problem with an X-ray examination. He continued to have shortness of breath, and his condition deteriorated. He was then transferred to the another hospital, and he passed away on the 23rd of March in Our Lady of Marino Hospital. And we also like to report a number of death cases, 42 of them between the 1st and 22nd of March, 33 male and the remaining females, and 1,350 patients have recovered upon and been discharged, and some 30 patients were found to be positive upon hospital admission screening. 30 other patients sharing the same ward were regarded as close contacts. So far, 20,399 HA staff have been infected, and 15,701 of them have recovered and resumed their positions. The floor is now open. This lady here. Good afternoon, I'm from Now TV. The number of confirmed cases now stands at about 13,000. How do you assess the situation? Is it on a decline? And this morning, the chief executive pointed out that she had made a request to central authorities for a team of Chinese medicine experts to come to Hong Kong. How many of them will come, and where will they work in Hong Kong, and what will be their responsibility? And Dr. Tony Ko also said that he has been liaising with private hospitals and private doctors in relation to arrangements for prescribing oral medication for private patients. How many doctors have received the oral medication, and are they allowed to prescribe these drugs to patients? In relation to the latest trend in the past 4 and 5 days, every day we recorded about 12,000 to 14,000 new cases. Comparing to early March or even earlier, I would say that there is a slight drop. However, we won't call it a continuous decline. At the moment, the number of confirmed cases remains at some 12,000 to 14,000, which is a high level. More observation is needed. We should not just look at, a figure for a day or a number of days because of fluctuations. So more time is needed to observe the trend. In the past 7 days, I would say that the number of cases has remained at slightly above 10,000. We have yet to observe a continuous decline, so we need to be careful. At the moment, there are still many infected cases, and in the community, continuous transmissions are still going on. And if we let our guard down, very easily there could be a rebound. Dr. Li will take the question on Chinese medicine. Our Chief Executive, Dr. Tony Ko, mentioned this morning that the Chinese medicine experts will be coming to help us. Details have yet to be announced, but in terms of Chinese Western medicine collaboration, we have the experience in public hospitals as well as the community isolation and treatment facilities in North Lantau Hospital. We have been providing the combined treatment to our patients, and at the moment we have some COVID patients in the AWE facility. And we've found that the Chinese medicine is helpful in relieving the symptoms for some patients, because for elderly patients, apart from COVID, they may also be suffering from other ailments. So we look forward to more collaboration to give better help to our elderly patients. For oral medication, we have a mechanism to address the issue. The oral medication is now available in private hospitals. We do supply the medication to them to an extent, and there is a clinical set of guidelines to follow that is about the age of 60. For private doctors, we will consider the situation on a case-by-case basis. There is a set of procedures to follow and some public health guidelines to follow in terms of procuring the drugs, and we'll continue to work with the doctors. Next question. I'm from TVB. Good afternoon. The usage rate at holding centers are on the low side. For Harbour Road Sports Centre, it's 18%. For Kai Tak Cruise Terminal, it's 2%. Is it because of few patients suffering from milder symptoms and fewer elderly patients? Will more holding centers be commissioned? Now, about isolation facilities, we have now enhanced the capacity, and if the confirmed cases wish to stay home during the isolation period, would they be sent to isolation facilities, and what are the criteria for determining whether they should stay home during the isolation period? Let me take your question on holding center for elderly people. Now, if there aren't many patients, and if in terms of our trend, be it the number of patients waiting at A&E for hospital admission, we can decide, for example, whether the number of patients overall speaking is dropping, and I believe if so, it will be good news for Hong Kong. And for holding centers, we have different practices. The centers are run by the Social Welfare Department, but the hospital authority also collaborates with the department. For example, if there are confirmed cases in a residential care home, and if necessary and deemed by the outreach team to be necessary, they will be sent to the holding centers for isolation. We also consider whether the environment of the care homes is suitable. This is in fact our existing practice. If the RCHE is deemed not to be in a suitable condition, then some of these patients will be transferred to the holding centers.
In relation to staying at the community isolation center. After we have received a report, we will make use of questionnaires, whether it is a case of RAT or PCR positive test to collect basic information. The information includes age, health condition, symptoms, and whether that person belongs to a high-risk group, as well as the home setting. Then we will conduct a screening. For some, because of their personal conditions, they need to stay at a hospital or residential care facilities. That's why they don't need to stay at a community isolation center. But for some other cases, perhaps they are living with high-risk persons. This group would have the priority to be moved to isolation facilities. In addition to that, we also look into other factors of the patient themselves. Say whether it's someone who is a carer or someone who needs to be cared for. We'll collect the information via the phone and make appropriate arrangements. Next question. The lady, the far back. I'm from Phoenix TV. I'd like to ask. We see that although there is a high number of infected cases, but it's a decreasing trend and we have more people recovered. But the death rate is still serious. Every day we hear about talks of decreasing the death rate. Well, have you assessed the effectiveness of current strategies? On the 23rd of March, the CE said that she has met with mainland experts. Well, given they discuss about the latest development of the epidemic, as well as policies adopted by the Hong Kong government. Have you received any latest instructions? In relation to the elderly, of course, regarding the death rate, we have to take into consideration different factors. We are in the process of making an analysis. We are currently enhancing our capacity to care for our patients. Whether it's a Tier 1 or Tier 2 ward, we have converted them into facilities that can receive stable COVID patients. In relation to AWE, the new treatment facilities with the mainland medical team coming to help, we have expanded the quota of patients we can take care of. There are currently 370 patients staying there. Previously, we only have the manpower to handle 200 patients. For stable patients, they can go to community facilities or holding centers. We haven't stopped in enhancing our capability to take care of our patients and the capacity of our facilities. The lady towards the left at the back. I'm from Hong Kong 01. A follow-up on a previous question on Chinese medicine. It's said that, it's used to help patients at WE. How? Are there patients that have shown certain conditions, say their conditions has deteriorated, or allergies or other irregularities after taking Chinese medicine? I'd also like to ask about death cases. There are 2 cases. Well, there is one who is a male, 48 years old, and a 53-year-old female. They have been admitted to hospital. Were they infected at the hospital? How many cases in the death cases had been prescribed the oral medication? I see that the overall death rate is 0.66%, which is slightly higher than before. The death rate per capita in Hong Kong is the highest in the world. Have you conducted any analysis to find out why it's so high? I'll first answer the first 2 questions. In relation to the use of Chinese medicine, I have already mentioned that elderly patients have their own medical conditions. So apart from the COVID conditions, there are other health conditions as well. Say, for example, constipation, cough. We find that Chinese medicine would help them to different degrees. We follow the current guidelines in the use of Chinese and Western medicine. Say, for example, whether we need to refer to a blood report before prescription. You mentioned about the young death cases, whether they were infected at the hospital. I don't have detailed information. But if you ask me if they've been prescribed any oral medication, anti-virus medication, the 24-year-old case has been prescribed Paxlovid. Every day we monitor the number of new death cases. We need to look at the denominator to work out the percentage. Sometimes for a patient who's been infected with COVID, but because of their own health condition, there was deterioration. So from infection to death, it might be a week. We have reported an additional 201 death cases. The time of infection might be earlier. So far in the fifth wave of the accumulated number of infections, 0.6% of the cases died. We have to conduct an in-depth analysis with the HA. We need to find out whether the cause of death has a direct or indirect cause or relationship with COVID, or whether the death was caused by something else, but it's just happened that the patient was infected with COVID around the same time. We need to get more clinical information before conducting an in-depth investigation in order to find out the number of deaths caused by COVID. Currently, we see that the death cases are highest among the elderly. In the fifth wave, for death cases involving the elderly, it's over 95%, and 70% of the death cases involve those over the age of 80. For this age group, the vaccination rate is lower. That's why in this outbreak, there are more death cases among the elderly people, and they are most affected compared to other countries. The accumulated death rate is similar to that in other countries. But our epidemic situation is quite severe at the moment. In the past 2 or 3 months, the death rate in Hong Kong is higher than other places because the epidemic situation is quite severe at the moment. And the vaccination rate among elderly people is low. We'll conduct an in-depth analysis into the cause of death before we can arrive at a more accurate figure.
Next question. I'm from Cable. Good afternoon. For the 45-year-old Indonesian patient who passed away, I'd like to have more details. Did she have any vaccination record? Did she receive the BioNTech or Sinovac jab? Do you have a preliminary cause of death for her? And last week, a 49-year-old female also passed away without any chronic illness history. Do you have any idea whether these two females reported their positive status? And a question for hospital authority. Many patients were not admitted to hospital until their conditions got severe. Do you have guidelines on how to monitor the health conditions? And the Education Bureau is now considering allowing DSE students to take the exam in isolation facilities, and these students would be infected or would be close contacts of infected cases. How do you make sure there aren't any loopholes? And another question. Private hospitals may be prescribed with oral medication following the guidelines. Now, will you relax the guidelines on prescription of oral medication? According to some experts, the oral medication can be made available to younger patients. When are you going to revise the guidelines? For the 45-year-old female, I mentioned she was an Indonesian helper. She had no chronic illness history, but she had 2 BioNTech jabs. She had fever, chills and rigors, and she started to have poor appetite on the 21st, and on the 22nd she was found to be unconscious, and she was sent to the A&E unit of Kwong Wai Hospital. But on her way, she had an arrest, and that means that she was unconscious. Upon resuscitation in the A&E unit, her pulse resumed, and then upon screening, she was found to be COVID positive. And at 1:48 a.m. on the 23rd of March, she passed away. So for this case and other cases, they've been referred to the coroner's court for further inquiry. I don't have other information. You ask whether some patients have arrived at our facility late, be it COVID or other health emergencies. They should come to our A&E unit as soon as possible. There are symptoms, for example, shortness of breath, continuous high-grade fever, and confusion, convulsions, or poor appetite in general. We will advise these patients to come to our hospitals for treatment. For oral medication, the private hospitals now use the same set of clinical guidelines as the hospital authority, and we are studying the issue with more scientific data available. Together with experts' analysis and advice, we will consider whether to further relax the guide for prescription. About the SE students and the examination arrangement, I believe the Education Bureau and the Hong Kong EAA will give full account of the arrangements. That is, if a DSE student is infected or if he becomes a close contact, what should the arrangements be? The DSE is an important examination for students in Hong Kong, so I believe the Hong Kong government will strive to ensure all students will be able to sit the exam. And in fact, we could make this arrangement in our centers, but further details should be announced by the Education Bureau. The Center for Health Protection, meanwhile, also keeps close liaison with the Education Bureau and the Hong Kong EAA in terms of infection prevention and control measures and other examination arrangements. We also provide our advice to the Education Bureau so that an infected DSE student or a student who is a close contact will be arranged to sit an exam to avoid cross infection. The speaker's off mic. The speaker's not using a mic. You mean she was confirmed with COVID? She was found to be COVID positive after she was admitted to hospital. The speaker's not coming through. She was found to be PCR positive at the A&E unit. So she will be regarded as a positive case. Next, an English question.
From the SCMP. So are there any progresses in implementing the 3 reduction proposed by the mainland experts, and do you have any figures to prove it? And the second question is, for the Delta case detected today, is it an imported infection? Thank you.
mainland expert.
Could you repeat your first question?
Is there any progress in implementing the 3 reductions proposed by mainland experts, and do you have any figures? Thank you.
I don't have any figures regarding what sort of mainland expert
Three
opinion you're talking about.
reductions，三減。
For the Delta case reported today, the case affected a 47 years old female who is living in Tat Phuc in Kowloon Bay, and she has received vaccinations, and she was first tested positive by rapid antigen test on the 20th of March, and subsequently she has another PCR test arranged by the Center for Health Protection on the 22nd of March, and the genetic sequence and show that it is tested positive for L452R mutation.
I think for your first questions, I don't have any figures or any statistics to support.
下一題。
Next question. This lady here. Good afternoon, I'm from Dot News. Dr. Ao just now commented that we should not just look at a single figure in determining whether the epidemic situation has stabilized. However, in recent RTD operations, the number of positive cases identified seems to be on a drop, on a decline. Does it mean that the epidemic situation in Hong Kong is improving or is ebbing? And about relaxing social distancing measures, some believe that we are holding hostage to fortune, and that when the epidemic situation gets better, sooner or later, these measures will be relaxed. Do you have other measures, meanwhile, to prevent further spreading of the virus in the community? First, on epidemic figures, indeed, I said that we should not just look at the figure today or yesterday in determining the trend of COVID now. Because of fluctuations, there might be, a leap of several thousand cases just in a day. We should rather look at a longer horizon in determining the trend. And at the moment, we look at 2 sets of figures, 1 PCR cases and 2 RAT cases. Looking at these 2 figures together, we will be able to better gauge the epidemic situation now. And as I explained just now, in the past 5 or 6 days, the number of confirmed cases have by and large maintained at a stable level on a plateau around 12,000 to 14,000 cases. It's difficult to predict the trend through social distancing measures and a series of initiatives such as compulsory testing notices and RTD operations. We will encourage members of the public to get tested, and if infected, these confirmed cases can be identified as soon as possible so that we can curb transmission chains. Only by implementing these measures would we be able to help ease the epidemic situation. The government will definitely consider the development of the epidemic in reviewing these social distancing measures. And if indeed the epidemic situation stabilizes with the number of cases dropping, the government, I believe, will suitably relax the social distancing measures. Of course, we need to balance a number of factors, including the epidemic situation and how the measures members of the public in their daily living. But however, the priority is to keep the epidemic situation under control. Without achieving that, and if we relax social distancing measures, definitely I believe there will be a rebound and there will be a surge in the number of confirmed cases. At this stage, through RTD operations and restarting the compulsory testing notices, we hope that members of the public who have visited high-risk premises or who lives in buildings with more infections will be able to identify more positive cases. In fact, in the recent week, through RTD operations, the rate of infected cases identified remained high, that is 8%. At its peak, it was 12 to 14%. So it represents a slight drop. But if you compare this figure with early or mid-February, I would say that we are still at a very high level.
Next question, the gentleman at the back. I'm from AM 730. I'd like to ask about a quarantine of those who have recovered. Yesterday, it was said that, well, there is no exemption of quarantine if you are recovered. However, at the same time, Dr. Ao, you said that if you live with someone and you have recovered, then you are exempted from exemption. So what is the case? I'd like to ask about patients who have died, whether they died with COVID or died because of COVID. Well, in relation to oral medication, well, there's a 24-year-old who is undergoing chemotherapy. What is the situation? About the 10 residential buildings, does it mean that, well, the criteria for RTD will change and it may change from 50 cases to a different number? And what about the Delta case? Was there still tracing conducted? About quarantine arrangements of recovered patients. The principle is that if someone is infected, whether it is by RAT or PCR, the person itself will have to be isolated. Those who live with that person will become close contact and will have to be quarantined at home. If that person has received 2 doses and the 6th and 7th day the test is negative, then that person could resume normal lives. However, if the virus has been passed on to family members who are under quarantine and these family members become positive, well, for the first infected person, because that person's already recovered, so there is no need to extend the isolation period. It's the first person who passed the virus on to other family members. And since that person has already recovered, the viral load would be low, and within a short time that person will not be infected with the same virus again. However, after a long while, if there is another family member who is infected, normally we will conduct tracing. And the original infected person lives with the new infected person. So the original infected person is a close contact. So if one has recovered and after a while that person may be infected again or be infected with a new variant. So normally under this circumstance, the original infected person will have to be quarantined again. In relation to compulsory testing, it was only the day before yesterday that we've restarted the CTN, the compulsory testing notice. Well, for the notice issued the day before, they will have to be tested yesterday or today. The screening criteria of places to be issued the notices, currently we focus on residential buildings. We make use of the 2 platforms to collect information, say for example, address of infected persons, to see which buildings have within the 7 days, for example, have seen a high number of cases and have never been included in a have never been included in a RTD. With a high number of cases there is a chance of transmission. So compulsory testing is required. If the line may not be drawn at 50. We adjust in accordance with our PCR testing capabilities. It should not exceed our testing capability, otherwise it will cause inconvenience to members of the public. We'll take into account the situation. In the future, if there is a chance that the number of cases drops further, it may not be 50 cases, it may be lower. We may adopt an approach of necessary testing to find all the infected cases. Number of deaths, experts will make use of a platform to have a discussion. There are 7 younger patients. 3 of them are terminally ill with cancer. I think we need to have further discussions to see if these cases have died off or died with COVID. For the 24-year-old male suffering from terminal cancer, well, for the convulsion, we think that is to do with the cancer. In the screening for COVID upon admission, it turned positive. His condition was stable. That's why we have prescribed antivirus medication. Later, when the condition deteriorated, we prescribed remdesivir and Paxlovid, as well as steroid and antibiotics. Whenever there is a case, of course, we will conduct a tracing and issue quarantine orders. First, to close contacts. If we will also conduct investigation. If there is no such need, the quarantine order will be revoked. I did not answer about questions in relation to the Delta. Currently, our public health laboratory have received about 1,000 or 2,000 samples for genome sequencing analysis. Not all positive cases will undergo the genome sequencing. We do sampling. So they are samples received by the public health laboratories or those received by the CHP. They may be samples from ICU cases or death cases. We will conduct a L452R analysis. For the case identified yesterday, we follow the principle. We will conduct the tracing. We'll issue an isolation order to the infected person and quarantine orders to domestic close contacts. We have a monitoring mechanism in place. Depending on whether it's an Omicron case or Delta case. In the past month or so, the public health laboratory from the 15th of February to the 21st of March have conducted L452R analysis on 130,000 cases or so. We have identified 660 cases or so that carry L452R positive, mostly identified in the second half of February. I think it was a time when there was the hamster cluster. Since the 6th of March, we've only identified 2 cases with L452R. That means the prevalent strength circulating in Hong Kong is Omicron.
Good afternoon, I'm from Ming Pao. A follow-up question. Yesterday, a confirmed case, an 88-year-old male fainted at home in Taiwan. We asked, but yesterday HA did not have information. Now, do you have the information? When was this patient found to be positive? Did he have any chronic illnesses? Did he visit any clinic? And did he take any oral medication? Now, 2 days ago, 10 buildings were included in the CTN compulsory testing notices, and the residents may not have undergone the compulsory testing entirely. How many confirmed cases among the 10 buildings have been identified? For the 88-year-old patient, we don't have information here. We can supplement the information later. About compulsory testing notices, the Food and Health Bureau issued notices, and residents who live in buildings subject to the CTNs must complete the PCR test within a specified period. Inspection will be carried out, followed by enforcement. As explained just now, our selection criteria are to pick buildings with more infected cases. Our concern is that there could be transmission within the building. Now, for the buildings selected, in the past 7 days, over 50 cases have been recorded, respectively. Last question, this lady. I'm from Orange News. Good afternoon. First, about CTNs. CTNs have been issued against 10 buildings in the past 2 days. Is that the yardstick to be adopted, and that you will issue CTNs against 10 buildings every day? And public rental housing in new territories account for the majority, or over 50%. Why is that? And Chief Executive explained that oral medication can be prescribed to patients because we have ample supply, and will the hospital authority prescribe more oral medication to more patients? And about number of patients. In AWE, 360 patients have been received by the AWE because of enhanced capacity. Is there room for more patients to be received there? About CTNs, we've just resumed issuing CTNs against high-risk premises and buildings. Depending on the PCR testing capacities in testing centers in the community, we may include more premises and buildings. That means we're going to select more buildings and premises to be included in the compulsory testing notices in the near future. These buildings are selected because of possible clusters of infected cases in these buildings recently. This is an indication that there could be transmissions going on in the buildings. So that depends on the number of infected cases in buildings. We have not made any preference as to whether they are private or public housing estates. Buildings will be selected and included in the CTN as long as there are more cases. For oral medication, the hospital authorities' principle is, of course, to ensure more suitable patients could be prescribed with oral medication. Meanwhile, we respect experts' views and scientific data. With scientific data available and with the accumulation of clinical experience, we're now prescribing more oral medication. As announced just previously, we had prescribed over 20,000 doses of MSD drug, and also for Paxlovid, likewise, we have thousands prescribed, and about 300 patients are now receiving treatment at AWE facility. We work in collaboration. We have 20 doctors and 100 nurses from the hospital authority, and also some 400 staff from the mainland medical support team. And as explained earlier, in the next 2 weeks, we hope to convert or fully utilize halls 8 and 10 so that we can receive about 400 patients. Finally, I'd like to appeal to the members of the public to give blood. The fifth wave of the epidemic has dampened the public's willingness to donate blood, and at the moment the blood bank is having a low inventory level. So I'll appeal to members of the public to give blood to us, because the storage is available for 3 to 4 days use by hospitals. So I appeal to your help to ensure we have ample blood supply. Thank you.